Hello, I'm Dr. Clint Sexton with Naperville Integrated Wellness. Today I want to talk about Hashimoto's disease, but I'm not going to put the emphasis on what's happening to the thyroid gland and the immune system, the thyroid and thyroid hormone levels, okay? Instead, I want to talk about other major systems of the body that tend to be affected with Hashimoto's disease. And it's these very systems and the dysfunction in them that could be creating the symptoms you're still experiencing with Hashimoto's. So let's go ahead and dive into this. Okay, so with Hashimoto's, we have the immune system attacks the thyroid, correct? And what's happening is the immune system makes antibodies that target the thyroid gland as something to be attacked and destroyed. But what we now know is that these same antibodies that go after the thyroid can go after an area of your brain called the cerebellum. So your cerebellum is in the back lower part of your brain. And typically when we think about the cerebellum, we're thinking about things like with movement, coordination, balance, things of that nature, very muscle and structural oriented. But the cerebellum is also involved in the health and functioning of other areas of the brain. And one very important area of the brain is called the hypothalamus, okay? So let's just slow down a minute, all right? So we have the immune system that affects the thyroid, we got that part, but the immune system can also now attack and affect your cerebellum. When that happens, we may get symptoms right there because of that. We may have, symptoms related to being, dizziness, or maybe we get car sick and things of this nature. That could just be a direct reflection of it affecting the cerebellum. But many times we don't see these direct symptoms of the cerebellum. Instead, we see the effect of it and how it is influencing the functioning of the hypothalamus, okay? So again, that hypothalamus, just another part of your brain, but it's controlling two other very major systems of your body. One of them is your autonomic nervous system, and the other is your endocrine system, which are your hormones. So let's just talk about the autonomic nervous system for a moment. It has two divisions. It has the parasympathetic division, which is the rest and digest, and it has the sympathetic division, which is the fight or flight, okay? Put those together, that's the autonomic nervous system. So this part of your nervous system influences digestion and what your heart is doing and what your lungs are doing and other organs in the body, okay? So if we're having a problem in that area, that can create a lot of symptoms, all right? Now, the other side of this is the hypothalamus also is at the root of controlling your endocrine system, which are your hormones. Typically when we think about hormones and we try to determine what's controlling those, we always go to what we call the pituitary gland. We call it the master gland because it makes hormones and it sends hormones out to the ovaries and the adrenals and the thyroid and things like that. But it has a higher center, okay, which is your hypothalamus. So the hypothalamus is making chemicals that are controlling the pituitary, which is then controlling these other organs that I just mentioned. So in addition to just what's happening with just the thyroid and just what's happening with thyroid hormones, that's just one piece of what's going on with Hashimoto's. It ultimately affects two major regulatory systems in the body, your autonomic nervous system and the endocrine system, okay? So there's a very good chance that a lot of the problems you're experiencing don't have anything to do with what's going on with the thyroid or thyroid hormone levels. So it'd really be useful for you to look at the blog, look at the diagrams, I put some links on there. It's just going to give you much more background on this. And if you have Hashimoto's, it's very important for you to understand these other concepts. Otherwise, you just go round and round thinking, what's happening? What's happening? It must be my hormones, must be something with the thyroid. It's a very good chance it has nothing to do with your thyroid at all. Okay? So I hope you have found this helpful. And again, check out the blog. Thank you.